Take you back to Sandton, where the Hospital Association of South Africa is hosting its annual conference under the theme Innovation and the Future of Healthcare Provision. The gathering brings together healthcare professionals, policymakers and industry leaders to explore new technologies, policies and partnerships that are shaping the country's health system. Watching developments for us is SABC News Reporter Katlego Legodi, who joins us once again from Sandton this morning. And Katlego, I imagine the voice of politicians is also going to be important given the role they play in governance.
A very good morning to you, Ayanda, once again, and to our viewers at home. You're right. I mean, a policy will be what informs how things move in the country. And today we find even politicians here forming part of those that have put the health care or the future health care of the country under the spotlight. Today, HASA just gathering various of these role players. Most of them are just coming through even from outside of the country to form part of the discussions here, trying to solve for the country's health care. You hear most of the conversations centered around the national health insurance, but at the same time, how do we reimagine innovation where healthcare provision is concerned? You hear them talking about policy as well, enhancement and consultation, but also can we at least have an affordable healthcare provision in the country that does not discriminate and does not show the stark inequalities that exist on the ground today? So most of them are just already coming into the Sandton Convention Center, inundated with trying by all means to ensure that the future is a bit different from where we find ourselves now and where we come from. I'm going to invite into the conversation MEC Vuyiswa Ramokgopa, who's joining us this morning as the MEC for Agriculture. And you're coming through, and one wonders as to what then becomes the link between agriculture and health. You've just delivered somewhat of a panel discussion. You were part of the discussion on the ground, just trying to explain how important the two really work together, can fuse together, but we need to get it right for our people. Welcome to the SABC MEC.
Thank you very much. And you actually ask an important question. What is an MEC of Agriculture doing at a health conference? And as I always say, health is the output, but food is the input. For us to be able to have a better quality of life, to be healthier overall, it starts with nutrition. It starts with what we put into our bodies. And before we even get there, it starts with understanding how we then localize food production, make food more affordable, more available for average citizens, because people in general are struggling with cost of living. Affordability of food is one of the single biggest crises that we are facing, because it leads to malnutrition, it leads to childhood hunger, and it leads to general household hunger. And we know that in Gauteng currently, 28% of Gauteng residents suffer from chronic to severe hunger. And this is a crime in a country that, one, says it respects human rights, but two, a country that actually exports food to other countries, and yet we can't feed our own people. So we are here to really advocate to say we need to have a much more systematic approach to healthcare. As a country, we could save ourselves billions on treating people who have chronic illnesses, diabetes and other lifestyle-related chronic illnesses, simply by making better nutrition more accessible, more affordable to the vast majority of South Africans. And it speaks to multiple levels: school feeding and school nutrition programs, but also ensuring that every child between the age of 0 to 6 years old has proper nutrition. I spoke about this and the connection between nutrition and education. You can't expect a child to learn on an empty stomach and still go out and excel in the world and compete with their counterparts in the world. So if we want to be more productive, we want to grow our economy, it starts with making sure that every single child in our country is not learning on an empty stomach, that they have access to food, and not just food to fill their tummies, but it must be nutritious food that helps them to grow their brains, their minds, be active, and be full members of society.
Yeah. There's a debate around the national health insurance and how we can reimagine a universal health care provision in the country. In there, you spoke about policy and how we can really go about it in ensuring that there is consensus around some of these issues that we're trying to resolve for the country, looking at the future. What is your thinking around the NHI and some of these issues, the bottlenecks that have already been highlighted by those that are here?
Well, look, I think it's fair to say we all agree that universal health care is something that we must aspire to and we must see implemented soon. I was about to say in our lifetime, but that's too far. Universal healthcare is one of it's the promise embedded in our constitution, and we have to be able to implement and act on that. Now, the conversation about how it's funded, where it's funded, is an important one. But there's actually a point that was made by one of the speakers today who says, in the private sector, you actually have excess capacity. So the private sector, there are hospitals, there are clinics, there are whatever, but the portion of society that's being serviced relative to the portion of society that's being serviced by public health care, it's vastly different. So what we need to solve for is how do we then bring private and public sector together to be able to work more collaboratively, such that when there's excess demand in the public sector, you should be able to make the capacity that's available in the private sector available to be used. Because ultimately, we want a healthier population. We want people to have access to healthcare. And in there, then the clever people must go and solve the funding models, write up the policies, write up the legislation. But we need to be able to agree and concede that within the private sector, there is capacity, there is efficiency, and we need to, as a society, be able to leverage and benefit from that. And it's not about bringing the standard of healthcare down. We don't want collectively to bring the standard of healthcare down. What we need to see is a collective raising the standard of healthcare and making sure that every citizen in our country has universal access to good quality healthcare.
Technology, just before I let you go quickly, how can we use that to enhance food production, for instance, but also how do we see it playing a role in the medical space in us reimagining the future?
Technology plays a critical role in agriculture, one, because they say data is actually the new gold. It's the new land. You know, even in Gauteng, which is a very small province in terms of land size, part of our success is our ability to harness technology and harness data to drive productivity in agriculture. So you will have farmers in Gauteng that are more profitable and more productive than those who are farming on far larger tracts of land. And so our ability to harness and use data to drive productivity is important, but also to be able to now start actually expanding agriculture to not just commercial. We must also be able to service smallholder farmers, small-scale farmers, be able to aggregate that produce so that they can become more commercially viable over time. And there's a lot of people who are developing apps to be able to connect small-scale farmers to buyers of produce so that we mustn't cry about market access, market access. The market is there. The question now must become, how do we connect smallholder farmers who are trying to grow and build businesses for themselves to the actual market that is looking for produce so that we can grow our economy.
All right, MEC, thank you very much for your time. MEC Ramokgopa coming through to give us a sense of how we find her here as a politician discussing, or those high-level discussions are continuing well into the afternoon, Ayanda, and you hear the minister saying there's a need now more than ever to push, to try by all means to ensure that we're not left behind. Back to you in studio for now, Ayanda.
Right, Katlego Legodi for that reporting. Thanks very much indeed. Katlego, live to us from Sandton in Johannesburg.